I'm Stuart Harlin. I'm a vascular surgeon. I focus mainly on peripheral vascular disease and minimally invasive treatments for people with arterial and venous disease. Today we're going to be doing a kind of multi-stage venous intervention on a patient who has really pretty severe venous insufficiency. So we're going to close off the main channels of his vein as well as several side branches, all as single setting. We're going to focus on a product called Varithena today. Varithena is a commercial polydocanol foam that is different from the typical foams that we make in the office. In most offices, when we use sclerosant foams, we make them between two syringes, and so you get kind of disparity with the size of the bubbles in the foam. The stuff we're using today is commercially made, so all the foams are uniform in size. So that makes an entirely different treatment distribution as far as how the product works. And its utility is that we can treat very large portions of a leg, if not an entire leg, with one or two injections versus a whole series of injections or versus using the heat catheters that need other things. We expect the results to be almost instantaneous. Basically, the vein closes very quickly after we do the procedures we do. And it sometimes takes a little while, a day or two, so you really start seeing results. Sometimes just because there's some swelling just from the procedure itself. But beyond that, we expect the results to be quick. The recovery is really very minimal. We tell people, we wrap their leg today, and we tell them to walk around and be largely active today. But certainly tomorrow and the following day, they can be back to largely completely normal activities. Now, obviously, we see people who do kind of extreme things and want to know if they can do their marathon training the next day. We say, well, maybe just a 10K training the next day. But they can do largely normal things within 24 hours of the procedure. And that's certainly a big change from the old vein procedures where you'd have large cuts and really be down for a considerable period of time. One of the missions of being a state-run practice is that we're specifically tasked to perform research and to look at outcomes in methods other than just financial. And as part of that challenge by the state, we have lots and lots of research protocols going on in both arterial and venous disease. Specific to venous disease, we have several different things going on simultaneously. We just started a new NIH grant to look at people who have venous disease as well as combined lymphatic disease, because oftentimes they run together. We've also just started another new trial looking at the Varithena product we're doing today as a specific treatment for patients who have ulcers on their legs from underlying venous disease. I think at UT Physicians we have the privilege of having access to a remarkable variety of venous treatments. And so we're not going to be a vein shop that just does greater saphenous or lesser saphenous ablations, but rather we have all of the technologies available, because vein disease is really different in each patient. And some people do well with heat catheters, some people need sclerosant foams. We also have the new skin glue. We also treat people who have vein problems outside the leg. For instance, maybe they have problems in their pelvis or they have problems in their central circulation, they have upper extremity stuff. We have the ability and the technology to handle all really complete total venous disease.